Hello, this is Dr. Yates, one of my favorite patients. This is Dave. How you doing?
I'm doing great. How are you?
Good, good. So what we wanted to show everyone, a lot of people think that, a hair transplant either is magic and you can get a full head of hair from nothing, like being totally bald and grow a lot of hair, or that it doesn't work. So there's a lot of miscommunication going on there. So we're going to show you exactly what we do and what we see every day. So David, you can basically tell your story. I mean, you were this is you before, right?
Yep.
All right, so you were kind of thinning all in this frontal area.
Right.
You didn't really like it, did you?
No, not at all. It's every morning I'd look at my pillow and see just a couple more hairs, and then look at my brush when I try to comb it, just a couple more hairs. So I could definitely notice the thinning, and I really just wanted to kind of take action with it. So that's where I found Dr. Yates.
Right, and we had talked before, like you're wearing your hair pretty short. Like I'm gonna bring this around. You can stay where at the camera. Now look, he's wearing his hair pretty short. He's had a little over 2,000 grafts put up to the front, and he still has his hair buzzed pretty short. Now I can guarantee if he had a strip, he could not do that. I mean, you never even considered a strip, did you?
No, that's the last thing I wanted to do, especially since my hair is so blonde.
And fine.
Yeah, it's blonde and fine, so I didn't want a big scar around the back of my head. And actually, typically I cut my hair probably around a 0 to a half on the back and the side, so that tells you how unnoticeable the scars are from Dr. Yates' FUE procedure.
Right, and we use like a 0.8 millimeter punch, 0.9 or 0.7. We use whatever the smallest punch is, we can get the hair out and the hair is not transected. If someone says they just use a 0.6 millimeter punch, it doesn't mean anything if they're messing up the hair. What counts is you use the smallest punch that the hair will survive. You can see 2,000 grafts to the front has really changed kind of the framing of his face. Has made a big difference. This haircut, everybody's wearing this haircut, and he'll never have to worry about his hair, losing his hairline. Now he just told me something interesting. His hairdresser doesn't even know he had a hair transplant. What did your hairstylist say?
I asked her about just baldness and if she can see my hair falling out eventually. She says, "Oh no, your hairline's great. It doesn't look like it's receding at all. I think you're gonna have a nice head of hair." And typically if people are going to start to bald, that she'll notice they're receding in their early 20s. And she hasn't really seen any signs of it, and she can't even tell that I've had a hair transplant, which is a really big testament to Dr. Yates and his staff and the work that they've done.
Wow, I can say that is, and I'm going to take a pat on the back for that, because the hairstylists are usually the people that will make comments saying, "Oh, I don't see any results," or "Oh, who did that?" or "Oh, that's magnificent." So we'll take that as they said, "Oh, that's magnificent." But I think he's had a great result. 2,000 grafts to the front. He has fine hair, so I think for fine hair, this result is like a grand slam. So he's off, I guess this is the holiday season, so I guess off to the clubs, right?
Absolutely.
Okay. We'll see you guys soon. It's Dr. Yates.